Good afternoon, everyone. I want to thank you for joining us this afternoon for the second of our webinars specifically relating to what's happening here on the ground and supporting our large businesses in the Santa Clarita Valley in response to the COVID-19 pandemic, as it's been named. If you don't recognize my voice, I'm Holly Schroeder. I'm President and CEO of the Santa Clarita Valley Economic Development Corporation, a nonprofit here trying to grow, hopefully, and protect, in this case, jobs here in the Santa Clarita Valley. And we have put together this large employer roundtable to focus on the largest companies in the Santa Clarita Valley that are employing. I think the large companies we've invited to these represent over 20% of all employees in the Santa Clarita Valley. So what you all do really has a significant influence on the overall local economy, and therefore we are deeply committed to supporting you as we navigate our way through this crisis. Today, what we're going to do is get another update from our medical experts at the hospital and to hear from them shortly. Then we're going to go again to Brian Kegley from Poole and Schaffery and talk about what the latest information that we know about what's happening on the employment law side. In our first call last week, there was a lot still unfolding. It had, we had just passed. Congress had just passed I don't remember the name, but the HR 2601. In similar fashion, the Congress has just passed the CARES Act, and so we're going to tell you what we know about that right now. Mark Emmer is going to talk a little bit about what that means in terms of your management decisions and what we know is in the bill. And then Ben Stone Walsh from Wells Fargo, which is the largest SBA lender in the country, is going to talk about what we know about, at this point, about new funding streams that are coming through that. That's obviously stuff that is very literally live since the House just passed the act this morning. But we're going to tell you what we know, what we don't know, and then, work on the next steps. Once again, you can submit questions. I will field those to our folks in your sidebar, which you can increase and decrease in size using the orange arrow button. There's a questions area, and please hit submit by hitting the little send arrow, and I will field those to the appropriate folks as we go along. And this will, again, be recorded, so if you do want to share it with colleagues or others, we will have that up on the EDC website and our YouTube page. Okay, so with that, Roger, I'm going to turn it over to you and your team at the hospital. This is Roger Seaver, CEO of Henry Mayo Newhall Hospital. Roger, off to you.
Thank you, Holly. Welcome, everybody. I'd like to provide just a brief update, but I think the healthcare side of it goes first. I'm going to ask Dr. Lawrence, our Medical Director of Emergency Care here, to give his perspective of how we're doing and a little bit about the volumes that we see on a regular basis.
Hi, everyone. Bud Lawrence, emergency medicine physician and director of the emergency department here at Henry Mayo. So just to kind of give you a global update of how our community is doing, how our hospital is doing. So far, since we initiated testing, we have actually tested around 184 patients. This is as of 1:05 this afternoon, half an hour ago. 184 patients tested. We have actually resulted 104 results, which sounds like not a large number compared to the 184 tested, but you have to understand that we're working with commercial labs currently. We are working with Quest. LabCorp is another commercial lab which has similar delays in turnaround times. I think the numbers that were presented prior, to me at least, were that Quest has the capability of doing about 1,200 tests a day, and that's 1,200, and they're getting about 10,000 tests per day to run. So obviously that's giving us quite a bit of a delay in getting our results, which is frustrating to say the least, not only for us, but more importantly for our patients. and your employees if they have been tested. We apologize for that, but unfortunately it's out of our control. We are working to bring that COVID-19 test in-house where we can get much faster turnaround times within a matter of about an hour or so. We have been working diligently with 2 different vendors, both of which we have the machines in place already to run the test. We just need the test itself. We're looking at hopefully getting to go live with that in the beginning of April, which is just around the corner to mid-April, probably at the latest. So more to come on that. With respect to our tests, we've got, like I said, 104 results, many pending, but of those 104, we have now, as of half an hour ago, 15 positive tests, which is about 14% positivity rate on the people that we've tested, which sounds very high if you kind of follow the numbers that are floating around there. But you have to keep that in context that number one, we have many tests that are pending. And number two, more importantly, we are really only testing high risk patients. So we're only really testing healthcare employees for the most part and patients that we feel might need admission. I think for the most part, many patients who have fever and a cough may have COVID-19, but overwhelmingly, most patients will have a very benign course of illness. So getting a test, particularly with the turnaround times we have currently, is not very helpful for most patients. So given the limited testing resources, prolonged turnaround time, that's sort of where we're at. So that's some of the data that's happening within our hospital, globally across the Santa Clarita Valley. I think many people ask me, I see what's happening in Italy, I see what's happening in New York, is this going to happen to us? Everything that we talk about today is evolving from a medical standpoint. I don't have a crystal ball, but I would submit for you that I think that our experience hopefully will be quite different than the New York and Italy experiences, not only, well, for many reasons. Probably the most important is population density. I think that our population density, we're much more spread out. I don't think you could be in New York City and be 6 feet away from a person at any time, it seems. So we have a much better ability to keep people away from each other here. We do not utilize a lot of public mass transit. I think that's a big differentiator for us. And in general, I think our patient population is overall healthier, less smokers, those kinds of things. So lots of variables, lots of unknowns, but my sense is, although I'll say it again, that I think that the sort of light lockdown that we have is absolutely understandably crushing for small businesses and for the economy in the short term, and perhaps for small businesses in the long term, and it makes me very sad on the inside. I think it is doing its job, hopefully, in sort of, as we've talked about before, flattening the curve. I think some questions have come in about whether or not the patients that we've had that are positive are travel cases or are community spread. We can't really disclose those kinds of details, but I can just let you know that it is definitely here. It's in our community. You have to know that it is here. You have to know that you can't catch it if you stay in your house and you're all alone. I mean, obviously, if you have family members that are going out, that is a risk. But you also have to know that most people who get this have a very mild course of illness. So, you know, I think we went over numbers before, but maybe 15% need to actually come into the hospital. And of that, only 5% of patients who get this need ICU or critical care. So, and I think you have to also look at age ranges. Obviously, the elderly are much more at risk than some of the younger populations, although we are seeing some younger people get sicker, particularly in the New York experience. So I think in general, yes, there is community spread. Yes, there's travel-related spread. I think all you need to know when you talk to your employees or your family is that it's here in our community, and we have to do our best to stay 6 feet away from people. I think the Department of Public Health has said that an exposure essentially is being within 6 feet of someone for more than 10 minutes without wearing a mask, or if they cough or sneeze on you. So don't let anyone cough or sneeze on you. That's a good take-home message. But I think your risk is more from maybe touching objects without washing your hands and then subsequently touching your face. Remember, it enters in through your eyes, nose, and mouth. And so the virus can survive on various objects for quite some time. So definitely something to think about there. And I think that Roger's going to talk a little bit about PPE and perhaps Marley. I think that our main factor is turnaround times on tests as far as internal preparations for the hospital and the questions of, is this hospital ready to serve our community? I am going to go out on a limb and say absolutely yes. I don't have a crystal ball. Anything can occur, but we have been preparing mightily for every eventuality. And I think that anything that comes our way, we have processes and plans in place to do our best to deal with those, I think much better than our other like-in-kind hospitals in the Los Angeles area and nationally. That's all I have. I think I don't want to talk too much, but I will stay the whole time to answer any questions should they come up.
Thank you, Bud. Holly, you want the slide on PP&E at the end, right?
No, you can do that now. Here, I'm putting it up.
Yeah, okay, go ahead and put that up. Just want to share on our readiness, as Dr. Lawrence has already talked about. You need to know that our normal capacity for patients exceeds our demand on a regular basis. But right now, with the near elimination of elective surgeries and other reasons to be in the hospital, our census is quite low, so our capacity is even higher than we would normally have for this type of crisis. But in addition to that, we're also looking at how to bring more and more beds into a critical care standpoint. Even though that's not our license, we're able to do that to handle this emergency. And we're putting in place all of the equipment and supplies that we could operate another 30 beds at a critical care level if we need to. Our normal license for that is 18 beds, so we feel good, and we already have 30 beds in place right now, plus we're working on the plans to add another 30 if needed. So we feel like that's probably more than we'll need, but trying to arrange all of the equipment and supplies after the fact, we know would be impossible. So we're standing ready and willing as we need to be a part of this community. I just want to say our staff and support systems are very strong, doing fantastic work in the light of all of this. But like any place that's in a risk area, anxiety occurs if there's a shortage of any needed product. So the PP&E, that is the protective personal equipment that's necessary to prevent the spread among our employees in certain patient care duties, we pay very, very close attention to. And the slide will show us the common items that we need on a regular basis, and our current supply chain, while it is being optimized, it is insufficient to be confident that the current supply chain meets all of our needs for the surge. So we're actively searching for vendors. We're actively reaching out to those that have facilities that can manufacture some of these locally, ideally, but in some cases, our business community has overseas manufacturing and can guarantee delivery dates. So we're very interested in all options that we have. And I know Marley could speak. We also have a very giving community. Many people are helping us through donations of various types, and we're trying to accept all of those. If we can't put them to work right away, we'll keep track of them and make sure the recognition goes where it deserves back into the community. So appreciate all the support. And if that slide could go up just a minute, Holly.
Is that not on screen?
No, not on mine anyway. Maybe it's on the audience.
Somebody else, I apologize, it looked to me like it was on.
We're looking at the PPE screen if possible. At any rate, I'll just speak to it. It's the masks, it's the gowns, it's the shields that are not on the, I don't think is on the slide, but a very important one is eye shields. When we're doing procedures or emergency care, it's very important to have eye shields. Not always important for the routine care, but very, very important, and we are not well stocked for that, and the vendors are not able to produce quickly. Although we appear to have some options locally, we have not fully vetted that yet. So we're very interested if anybody can help either to manufacture or supply eye shields called pappers and cappers, depending on their particular use. Those are very important, especially if we have the surge that most people talk about.
And I think when you this is Dr. Lawrence. I think when you think about it, intubating patients, you've heard this term, putting a breathing tube down, is really one of the most dangerous things you can do with a virus that is spread by respiratory droplets. So, and we really, that is not having these face shields or these lenses for the cappers, which are the face shields for the cappers, it has the potential to be a liability for a healthcare team. So if there are any companies locally who are able to maybe transition service lines to assist with that, that would be greatly appreciated.
We have, this is Marley Laufer. We have had a very generous response from the community to date. Many contractors, people in the building industry have dropped off the N95 masks that they might have had. The Hart School District found a great supply of surgical masks that they didn't even realize they had, that they were able to donate to us. And College of the Canyons nursing program, which is obviously suspended right now, we're able to donate a lot of their equipment to us as well. So we are accepting anything along that line. Holly has put us in touch with hand sanitizer, company that has an excess of that. But in particular, with the masks, both surgical and N95, we're also looking for non-latex gloves, and then as the face shields and eye protection. So we can accept them through the foundation, and we are very grateful for anyone that has those resources. And then, as Roger and Bud said, if we're able to have companies that manufacture or are looking to transition to manufacture these types of materials, we certainly would like to talk to them as well.
I think that's it for the quick update, and we have other subject matter there for you. So thank you for your attendance.
Great. Thank you, Roger. And I just say, to piggyback on what Marley ended there with is, if these are pieces of equipment that you might use in your manufacturing, or you might know of other companies in the areas that might have inventory of these that is perhaps not being used as much at this time, please contact me or contact the hospital if that is something that we can help with. We certainly want to keep their inventories up. We keep hearing lots about the news about the issues that other communities are facing, and so we definitely want to protect against that. Okay, going back to our agenda, keeping things moving along, I definitely like to be very efficient with your time. So our next speaker is going to be Brian Kegley from Poole and Shaffery. You heard from him last week, and he certainly is an expert and is tracking all of these developments as it relates to employment law. And so, Brian, I'm going to put the floor to you. Let me put up your slides, and there we go. Floor is yours.
Excellent. Thank you, Holly. Thank you to the EDC for hosting the series of webinars that you have been working with the large businesses in Santa Clarita and the surrounding areas. Very appreciative for the opportunity. We have a lot to go over in a short period of time today. I am going to start with a review of the Families First Coronavirus Relief Act in just a moment, but I can announce that right now, as we speak, President Trump is putting pen to paper on the Senate CARES Act, but I'm going to defer to Mark Emmer, who comes up after me, to speak about some of the key issues that are going to be in that bill to assist. I'm going to be focusing primarily on the employment-related issues that arose from the FFCRA. Specifically, for those of you who did not hear how things went down last week, let me just give you a quick recap. Last Wednesday, on the 18th, the president signed into law the FFCRA. Again, that stands for Families First Corona Relief Coronavirus Relief Act. What it does basically is it becomes a bill that is effective. It is April 1, not April 2, as everyone has been reporting. Although the bill itself said it was effective in 15 days, the Secretary of Labor basically advanced that a day to make it effective April 1. So please make sure that you are acting accordingly, because that is 1 day in advance of what everybody had been reporting. This bill still does remain as a sunset provision on December 31st. That means it does not continue on into the next legislative session next year. It may be extended for all intents and purposes by executive order in the event that it becomes necessary, but at this point it is still scheduled to sunset on New Year's Eve, hoping and praying that we'll be through it by then. This was stage 2 of the 3-stage stimulus process. This is really the protection for workers that was put into place. The stage 3 is the Senate CARES Act that I mentioned Mark will be speaking about, and that is really business driven. This particular bill only applies to those businesses that have under 500 employees, and that is 500 employees across the nation. If you have 8 different locations of your businesses, and across the 8 locations in 8 different states, you have 500 employees, it will apply to you. It is using the single enterprise rule as defined in the IRC, which is the Internal Revenue Code. The interesting thing about this is there is a specific carve-out exemption. The first is for nurses and doctors and first responders, but the second is for smaller employers, those that are under 50. However, there is not the clarity that we wanted to have by now to say who is and is not going to be subject to that if they're under 50 employees. All we know at this moment is that you will have to demonstrate an economic hardship to comply with the provisions of the family medical leave portion of the bill in order to get an exemption. We do not have the clarification of what that means. It will be clarified here within the next 10 days by the United States Department of Treasury, but at this moment, we do not have that information. The FFCRA has 3 major elements that you need to be aware of. The first is the emergency paid sick leave. The second is the emergency family medical leave. And the third is how the tax credits work. Next slide, please. As part of the emergency paid sick leave provision of this bill, the basics of what you need to know are this. It provides that any employee who works in your business that is employed on April 1st is entitled to take up to 80 hours of paid sick leave if they are a full-time employee. Part-timers are entitled to a prorated portion of that. If you let an employee who regularly works 24 hours per week, that is a 60% rate. You take 60% of 80 hours, they'd be entitled to a 48-hour paid sick leave under this policy. This applies immediately and is in use regardless of how long an employee has been employed with their business. If you hired somebody on Tuesday, the 31st of March, on April 1, they will be entitled to this benefit. What is interesting about the 80 hours is the way that it gets administered and how it gets paid. The government has created kind of a 2-tiered approach. I call it 2 tranches or 2 buckets of leave that are available. The first includes the first 3 bullet points that are on your screen right now. First, an individual who is subject to federal, state, or local quarantine or has been placed on an isolation order related to COVID-19. The isolation order may be related to their own diagnosis of being positive for COVID-19. It can also apply if someone in their household has been tested positive. Those of us who are in the state, we are subject to a stay-at-home order, not necessarily a true quarantine. That does not mean that everybody that you had to send home, if they were sitting at home waiting for work, is going to be eligible for this benefit. It will be dependent on a number of issues, and you need to speak to counsel about those issues because it is very case and fact intensive. The second group of people are those individuals who have been advised by a healthcare provider to self-quarantine. You are, as an employer, allowed to ask for a doctor's note. If somebody just says, my brother's, sister's, cousin's, dog's former owner has COVID, so I need to stay home, that is not sufficient. You can say, I need a doctor to confirm that you are in self-quarantine in order to provide this particular benefit. The third category, those individuals who experience symptoms of COVID-19 and are currently waiting on their diagnoses. As the doctors from Henry Mayo indicated earlier, the range of time is really dependent on the private labs themselves. It can take anywhere between a couple of days and 5 or 6 days, depending on when, where, and how you're being tested. So if they are exhibiting symptoms and have been tested, awaiting results, this leave will apply to those individuals. So for these three groups that we call in bucket or tranche number 1, they are entitled to receive 100% of their regular rate of pay for up to 80 hours if they are a full-time employee. What does that mean? That means you, the employer, are legally obligated to continue them on their salary or their hourly wage for as long as they are ill, unable to perform any work or telework, meaning working from home, in these circumstances, in these three circumstances, I should say. The interesting thing about this calculation is that the regular rate of pay is something that is designed to be managed by the Fair Labor Standards Act. The regular rate of pay is not just an hourly rate for your employee. It may not just be the salary for your exempt employees. If they are subject to any kind of commission agreement, any kind of bonus plan, any kind of incentive pay that they typically receive on a regular basis, those payments must be taken into consideration when averaging the regular rate of pay. The Fair Labor Standards Act, FLSA, says that we take a look back for a period of 90 days in order to determine how much an employee earns on an average work day. You must, as the employer, compensate them equal to their regular rate of pay at that point for 80 hours while they're out on this particular level of sick leave. So that's bucket number 1. Now let's talk about bucket number 2. That is for the next 3. Yes, Holly.
Brian, before you go to bucket 2, this goes into effect April 1. If a employee is laid off or furloughed prior to that, is the company on the hook for these paid sick leave?
Great question, Holly. The answer to that is no. The employee must be an active employee on your payroll at the time of that April 1 kicks in order to be eligible for these benefits. Additionally, we got clarification late Wednesday night from the Labor Commissioner that if you, as an employer, advanced benefits, if you gave them sick leave or PTO to deal with their own illness or the illness of a family member, or to stay at home to care for an ill child prior to April 1, you do not get credit against the FFCRA. This is inconsistent with what the Secretary of Labor, Scalia, had initially said, that employers would get credit for it. Candidly, I think it's against the public policy to say that an employer doesn't get that, because we've had folks who have been sick for weeks. And if an employer, in the goodness of his or her heart, advanced that leave, it would certainly seem practical and pragmatic to give the business credit. But that is not the state of the law today. It only comes into play for employees who are on the roster, on the rolls, on April 1. Anything that was advanced to employees prior to that is not qualified for the benefit plan. So moving back along to bucket number 2, the last 3 bullet points on your slide. These are individuals who are caring for another person who is subject to either of the points described above, meaning they're caring for an ill person who's been diagnosed or who is awaiting a diagnosis. Those individuals who are caring for their son or daughter due to the school or daycare being closed, or those individuals who are experiencing substantially similar conditions to those of the COVID virus, but have tested negative, meaning they may have a persistent cough, they may have a fever, other indicators of flu or other illness, but they do not have COVID-19, and they have confirmed that they do not have COVID-19. For these 3 individual groups, they are not entitled to 100% of the benefit of pay. They are entitled to 2/3 of their regular rate of pay. That 2/3 can also be capped at a daily maximum rate of $200 per day. However, the 80-hour rule and the prorated average for part-timers does apply for the first 2 weeks of the illness that an individual is dealing with under this second bucket of time off. Go ahead and move along to the next slide. So now that we've talked about the paid sick leave element of the bill, now we need to talk about its little sister. We need to talk about the other element that is separate and distinct. A lot of folks out there are combining the paid sick leave and the family medical leave elements of things, and they're confusing the factors. I want to make sure that we're drawing a distinct line in the sand so you understand that there are two different requirements on the employer. One is the paid sick leave. The second is the family medical leave. Under this emergency family medical leave portion, an employee must have actually been in your employment for 30 consecutive workdays prior to executing their benefits. That means that same employee I spoke about in the last slide that was hired on March 31st, they would not be eligible for family medical leave under this bill until April 30th. They do not trigger new benefit on April 1 the same way they do with the sick leave bill. Eligible employees will be entitled to 12 weeks of job-protected leave. That is inclusive of the first 2 weeks being covered under the sick leave bill. That means it would be 2 weeks under the sick leave provisions and an additional 10 weeks under the family medical leave portion of this bill. When an employee is unable to work or perform telework, and telework is kind of the fancy new way of saying work from home, because their minor child's school or child care service is closed due to a public health emergency, that is what is triggering the obligations under this particular element of the bill. Keep in mind that the carve-out on this particular portion is that the first 10 days that a person is out for this portion of the leave is unpaid. It is not qualified for the leave program. Now, if an employer would like to offer to allow the employee to use their PTO, that's paid time off, including sick leave or vacation leave or personal days if they have those accrued, you may ask an employee if they'd like to use it during that time period. However, you cannot, as the employer, mandate that the employee use their paid time off banks. If they choose to take the time as unpaid time, you must permit them to take it as unpaid time. During the time period that an employee is on their emergency family and medical leave, the employer continues to be obligated to pay 2/3 of the regular rate of pay, not to exceed $200 per day, and $10,000 is the total aggregate sum that we cap this particular benefit at. So, a lot of employers stand back and they say, well, wait a second, who in the world is going to pay for this? Well, the employer is responsible to advance these sums to the employee as part of its ongoing obligations of being basically the benefit of being an employer in the United States of America. Next slide, please. The way that the Congress has decided to help businesses pay for this is through tax credits. Unfortunately, folks, we don't have the clarity that I'd like to have at this point on the tax credits. What we do know at this point is that there are tax credit limits such that the federal government will allow you to deduct from the payroll tax portion of what you would normally pay at the end of every given month or every given pay period to the government. You are allowed to take a dollar for dollar offset up to a maximum benefit. The maximum benefit, if someone is taking paid sick leave, is $511 per day. If you have a very high wage earner and their daily rate is somewhere in the range of $1,000 a day, you are still legally obligated to pay them that $1,000 per day, but your maximum deduction, your maximum tax credit is only $511 per day. Now, that does take us up to all individuals who are earning $133,000 per year. So it will cover a majority of employees. However, those higher wage earners will basically have to continue to be paid with no tax credit extending to the employer. And then if the employee is taking time off under the Family Medical Leave Act or under that bucket 2 that we analyzed under the paid sick leave, you are entitled as the employer to take the full $200 per day tax credit against the payroll taxes that would have been owed at the end of each given month. There is a carryover provision for the tax credits, meaning it goes month to month. You don't just use it or lose it. The interesting question that we do not have an answer from the DOL yet is whether or not, because this bill sunsets on 12/31, whether those tax credits disappear if you still have them hanging around. We don't know the answer to that. We are awaiting clarification. Let me just finish one last thought, Holly, and I'll chip it back. We are waiting for clarification from the Department of Treasury to determine how we report this information and how we deal with our local payroll companies in order to ensure that those payroll taxes stay in your checking account and do not get transferred to the federal government. Holly.
So some questions coming in. I think you'll probably be able to interpret it better. It's covering the 80 hours, but can the employee, is there an application they should be doing for sick leave benefit and or medical leave benefit through EDD? And how do those things all, just maybe recap how those work together or don't.
Well, they do not work together. The only way that an employee would be entitled to benefits through the EDD is if they're not receiving it through their employer. Because this applies to all employers under 500 employees, if you fall within that category, you, the business owner, are responsible for paying this benefit. If they end up having to go through the EDD, the state will have recourse to come back after you for any benefits that they advance to that employee. Now, with that being said, if an employee has already been furloughed, has already been laid off, or has already been part of a work share program such that their hours were reduced based upon your reduced workload before April 1, the EDD may pay a portion and you may pay a portion in the event that the benefits do accrue to that individual. And when I say accrue, I want to make sure I'm being clear. Remember that this only applies if the employee is sick, if someone around them is sick, if they've been directed to quarantine by a medical professional, or they have no child care while schools are out and they need to exercise the family medical leave. This is not just because somebody is afraid of getting sick. This is not just because they're being asked to work from home and they don't like to work from home. There has to be a medical tie to the reason as to why the FFCRA is being triggered. In the event that you have previously laid off or previously furloughed, the EDD, Employment Development Department, will pay unemployment insurance benefits for those individuals who qualify.
Okay.
Okay. Next slide, please. Oh, you know what? Before you move to the next slide, one quick thing on this last slide. The interesting thing about the FFCRA, it only applies to those businesses that have employees of 499 or below. If you have 500 or more, you do not have access to the obligations, the responsibilities, or the tax credits. When asked why it was limited to 500 or lower, Speaker of the House Nancy Pelosi stated in her press conference that businesses with 500 or more employees should already be providing benefits equal to or greater than what's provided in the FFCRA, and that Congress did not intend to supplement or provide tax credits to the larger employers out there. They didn't want to incentivize them to provide the same benefits. They figured that the companies would do that on their own. So that's where the 500 employees came from. Next slide, please. Here are some additional resources that just became available late Wednesday afternoon. In fact, ironically, the Department of Labor just sent out a notification. They clarified two of the questions that made absolutely no sense that they had on their FAQ page. So there are two general guidance proceedings that are on there. The top one is for employees so that they can see what's going on. The bottom one is for employers so that they know what their obligations are. There is an FAQ page that the DOL has put up there. I will tell you that 90% of it is geared towards employee questions. The last 6 are for employers, and they're really designed more for those employers who have collective bargaining agreements or union employees. At the bottom of this page is the link to the mandatory poster that every employer in the U.S. under 500 employees is required to post in a conspicuous place in their business. If you have your labor law posters up, say in a break room or in a side room, you can put this up with that. You are required to do it. Ironically, there is no guidance whatsoever for those businesses that have already been put on stay-at-home orders where people are working from home and aren't coming into the break room. So for now, all you have to do is post the poster in a conspicuous area. Next slide, please. So now that we've talked about the FFCRA, I kind of want to come closer to home here for a moment. So as of today, there are now 22 states nationwide that have issued their own stay-at-home orders. Most of us know that California, always at the tip of the spear, was the very first to issue a full statewide stay-at-home order. That was done last Thursday on the 19th by Governor Newsom. 4 other states since that time period have issued rules restricting essential business only type scenarios. 3 of those 4 states are moving to a full stay-at-home directive over the course of the next 7 to 10 days. President Trump indicated as recently as yesterday that he has no plan for a nationwide stay-at-home directive. However, as we start talking about it being 25 and 26 states that are participating in this, it may be just a matter of time before we have a nationwide decision before us. Next slide, please. As of this morning, we actually have a little bit of new information. I've titled the slide "As Goes Los Angeles County" because we have been out in front of this thing from the get-go. We had Safer at Home issued last week before the state issued its rulings. We had specific carve-outs of who essential businesses are laid out with great specificity. But as of yesterday afternoon, I should say, this was published last night about 8:15 p.m., we actually have an expansion on the Safer at Home program in Los Angeles County. So for those of you who have employees who are in LA County, this applies to you. There is an additional mandate on the self-quarantine to anyone who has been exposed to another person with a COVID-19 diagnosis or symptoms. This means that the person must stay in quarantine for no less than 14 days from the last time they had exposure to an ill person. You can't leave your place of quarantine for 14 days except to go to medical appointments in these circumstances. So no going to the grocery store, no going out and running errands. You literally can go to your doctor's appointment and come home, and that is it for the 14-day quarantine period. Here's the funny part about this. If you do not follow the self-quarantine order, and I quote, the health officer may take additional action to include civil detention at a health facility or other location to protect the public's health in an individual who is subject to this order, who violates or fails to comply with this order. What does that mean? You can be arrested and you can be put into a civil detention facility if you know or have reason to believe that you've been exposed to the COVID-19 virus and you choose not to follow the self-quarantine order of the County of Los Angeles. Taking it one step further, there's an additional mandate to self-isolate for those ill residents for the longer of 3 days symptom-free or 7 days since your symptom began. What is the difference? Self-isolation means that you have to distance yourself from the people in your own home for that time period. If you do not do that, you are also in violation of the county order. This particular portion of it, the self-isolation order, takes it a full step different. And this is different than what we've been advising employers all the way up to yesterday afternoon at 5 p.m. Now, there is an affirmative legal obligation upon an individual with a positive COVID diagnosis to notify anyone that they've had close contact with while symptomatic so that they are forced to self-quarantine themselves. It had been up to this point that we were instructing employers not to have discussions with co-employees, colleagues, supervisors, etc., disclosing who the individual is that is ill. Why? Because there is HIPAA and privacy and protections for every employee that's out there. Under this directive, under this order, the employee or the coworker or the supervisor who becomes ill has an affirmative obligation, a legal requirement to notify those individuals that they worked in or around. Anyone who came within the 6-foot radius on the social distancing for a period of more than 5 minutes at any time in the last 14 days. If we do not follow this particular directive, it is a misdemeanor, punishable by 6 months in county jail, a fine of $1,000, or both. This is the largest expansion on the self-quarantine orders of any location in the United States at this time. Next slide, please.
And Brian, I want to clarify it because of the way you said it, just for everybody, because I think everybody on the call is here in the Santa Clarita Valley. This is a public health order. Therefore, it applies both in the unincorporated county and in the city of Santa Clarita.
Thank you for that clarification, Holly. That's a very good clarification.
I do have a couple other questions to go through your rest, and then I'll bring one more question coming in. That's a good one. Okay,
let me wrap this last slide, and then I'll take that question. Couple best practices for everybody to consider, for everybody to follow. First of all, the U.S. Department of Labor notification must go up. That's an obligation, not just a best practice. I gave you that link about 3 slides ago. If you do not already have your Cal OSHA notice up, that became effective and mandatory as of March 6th. It has not become, they haven't taken away the mandatory posting requirement. There's a link to that. That can go up in your work area as well. The third one, I just like, it's the CDC guidelines for cleanliness, reminding employees to clean off their workstations, reminding them to maintain social distancing, how they're supposed to cough into their sleeve and not into their hands if they are ill, and to wash their hands. I can't tell you just how we would have been so much better off if people had been following these rules and regulations all along. Put it up everywhere. Put it up in your kitchen, put it up in your restrooms, put it up at your common work areas. Reminding people of what their obligations are to help keep everyone healthy is a year-round requirement. It shouldn't have taken COVID-19 to remind us all. Second best practice, make sure you are communicating with your employees. Humans are social creatures. Being isolated, working from home, doing this telework, telecommute type work is going to take its toll on people's mental health. Connect with people on a daily basis if you can. Communicate any policies, any revisions to your planning. Every time the law changes, and right now it's basically on a daily basis, you should be sending out a blast to everybody saying, oh, okay, we're changing course. We're now doing things differently because of X, Y, and Z. Maintaining positive reinforcement. I know it's hard because we're in a really difficult time and we're really concerned about output and productivity, but make sure you are complimenting people. Make sure you understand, or they understand that they're a part of your team, because that's just good management and good leadership. I put a bullet point up here yet again because it is so important for us to remember to maintain social distancing. If you've got people coming into your workspace because you are an essential business, you should be making sure that they are not sitting right next to each other while they're working. If you need to make accommodations and you need to run multiple shifts, if you're a production facility, then you run multiple shifts so that people aren't sitting right next to each other or within that six-foot radius. And then finally, you need to make sure you're assessing your business continuity plan. How are you going to make sure you survive this time period? Mark will talk about this in just a bit, but whether you're talking about this lasting 6 weeks or 6 months, we need to have a best case and a worst case scenario in place so that we can plan accordingly to keep our businesses afloat. I apologize I went way over my time, but I hope that that was useful information. Holly, you said you had a couple more questions for me?
I think you sort of covered one of them on that talk. If for those companies that did close due to safer at home back what seems an eternity ago, like a week ago, or a week and a half ago, when they reopen, if they hope to reopen in April, after April 1st, is that employee still 30 days? Do they count as being 30 days employed for the qualification for family medical leave under these provisions?
It's a great question, and that's one of the questions that we've sought clearance and clarification from the USDOL, because the question became, they're still technically a regular employee if you had furloughed them, right? If prior to that time period they had worked for you for more than 30 days, I think that the best practice is that they would be entitled to the benefit upon their return. We do not have specific clarification. I do anticipate we will see an answer to that question because I'm not the only one who is asking it. So unfortunately, I can't give you a definitive answer at this time.
Okay. Stay tuned with all of these things, more to come. Okay, so we are going to move on to Mark Emmer. I've heard from him before, leading strategist around business continuity and all these things. And Mark, I'm going to need to run, I know you sent me a note asking me this, I'm going to need to run your slides due to the mode here. So I'm going to go ahead and put your slide up there, and you just tell me when to move.
All right. Good afternoon, everyone. I do have one caveat. I'm a strategist. I'm not an attorney or a banker, so I'm going to do my very best here to help you all interpret this very complex 1,000-page stimulus package, which was just signed into law today. So as you've heard, the Coronavirus Aid, Relief, and Economic Security Act is sweeping legislation that not only provides a backstop for our economy against a prolonged recession or depression, it's in fact an unprecedented safety net to the American people, distressed industries, and to small businesses. Go ahead, Holly. To that end, the bill includes the Paycheck Protection Program, which will provide those companies with less than 500 employees federally guaranteed loans of 250% of a company's average monthly payroll, which will likely to be forgiven if a company were to maintain its payroll through June 30th. Those who qualify will include independent contractors, businesses and nonprofits with less than 500 employees, and there is a special provision for Sector 72 companies. So those are companies who fall under the U.S. government's NAICS code for accommodations and food and beverages, which provides some relief to our local restaurants. Go ahead, Holly. The stimulus further will provide a program, this program will be administered by the SBA lenders and not by the SBA itself. And those lenders will be on a fast track to expedite the loan processing. I look forward to hearing from the bankers a little later on how long they think those things might take. The loans cover payroll costs, paid sick leave, employee salaries, health insurance premium, and mortgage payments and rent, and any other debt obligation that provide immediate access to capital for small businesses who've been impacted by COVID-19. Go ahead, Holly. Here's the sticky part of the bill. The bill calls for companies to make good faith claims that they are facing material impacts to their business, but not until the regulators offer us any specific language will we really know what those hurdles are. So I've been hearing concerns from clients, things like, will the banks require us to fully utilize our existing financing or credit lines before they will provide us with SBA financing? The maximum loan amount will be $10 million and will require no personal guarantees. There will be exclusions for certain employees who are high earners over $100,000 a year. The calculation of payroll is for the prior 12 months from the time that you filed your application, and you can hire back workers who you've already laid off. Go ahead, Holly. Now, should you use the funds for purposes that are later disallowed, the funding will just be treated as a low-interest loan at around 4%. And there is other relief in this bill, which I won't cover today, such as the forgiveness of SBA loans, for example. A commonly asked question today has been, can this financing be commingled with SBA disaster relief funds? And I really can't give you a clear answer on that, but what I can tell you is the intention of the law is not to double dip, but there are provisions in this bill that strengthen those provided under the prior stimulus measures as it relates to disaster relief. And the most important thing that I want to share is you need to get in front of your bankers now for multiple reasons, not only to ensure that they don't tighten up your existing credit lines, but we would expect these SBA lenders to be pretty much overrun in the next number of weeks. So we'll be providing a link to you with a caveat that what's in the link represents the bill as a couple of days ago, and we don't really know if any of the language has changed. Go ahead, Holly. So I would just like to, in closing, reemphasize a few things. First of all, we don't really know how the regulatory agencies will interpret this legislation. And so it might be a little premature if you were to take any drastic action in your business, including reductions in force, furloughs. And what I would advise you to do is give it a number of days until those things become more clear. And this provides us an opportunity to retain our best workers and also to be in a position to take advantage of some opportunities that we might see on the other side, such as acquisitions or taking share away from weakened competitors and that kind of thing. So I'm highly encouraged by this stimulus. And as I said in our call last week, our businesses are under stress, but also our employees are under a lot of stress. So this is the time to inspire our confidence at this critical time. Our leadership values and character are being tested at the moment, but I'm confident we can come together as a community and rise to this challenge. Thank you, Holly.
Thank you, Mark. So obviously that is a super fast overview. As Mark said, I mean, while we've been on this call, the bill has been signed. So you will undoubtedly be barraged with another 1,000 emails of people interpreting what's in there. And we can, if people want, schedule another call in a week time or so, week or week and a half, as things become clearer. But I want to turn over to our last speaker here, Ben Stonewalsh from Wells Fargo. As I mentioned earlier, Wells Fargo is the largest SBA lender in the country. And while as with the bill, 1,000+ page bill just being passed, I'm not sure Ben has a ton more specifics, but Ben, I just want to weigh in on what you guys are hearing and thinking and what your clients are asking and what you know at this point.
Thank you, Holly. Can everybody hear me? Hear me okay? Holly, can you hear me okay?
Yep, you sound great.
Okay, wonderful. Thanks for having me. Good afternoon, everyone. My name is Ben Stonewalsh. I am the Regional Sales Manager for the SBA Group for Los Angeles County for Wells Fargo. What I want to do, Mark alluded to he not being an attorney and not being a lender. I am a lender, and unfortunately, we probably have just about as much information as what you've just seen from Mark as well. So what I want to do during today's call is kind of set the table for where things sit today with lending institutions, give you guys maybe some common questions that we're receiving on an hourly basis, and hopefully we will all know more as this begins to be rolled out. From where we sit, since this call has started, I've received correspondence that the President has signed the stimulus bill. So what that means is the next steps are that the bill will be passed over to the US SBA to determine how the banks will be able to participate in the program. Where we sit at this very moment is that the SBA has not given us any final direction on eligibility, the documentation requirements of employers, or what that application process is going to look like. So I will apologize in advance for not having a lot of information, but I'm going to give you the information that we have to date. I know Mark had mentioned one of the things you guys should potentially do is start reaching out to your lenders. I definitely would recommend you start reaching out at a minimum just to get yourself, if you will, on kind of the front lines of wanting to hear back when more information is ready to be disseminated. But I do want to just let everyone know there's a lot of misinformation being sent currently through emails, through blogs. What is definitive as of now is that there is no queue for borrowers to line up, if you will, in anticipation of the program. So just because you call a lender, you won't be necessarily placed in the queue because there is no queue being enacted by the SBA currently. There is no current application for borrowers to complete or a list of financial information that you guys can begin compiling in anticipation of when this is launched. So I'd love to be able to give you an A to D list of what information you need to have. I don't want to provide you with that information for fear that you may be collecting a lot of information that may not be pertinent. Wells Fargo will be actively participating in the program once direction is provided by SBA. This should apply to the other institutions that are participating as well, but everyone at this point is kind of at a sit and wait, a bit of a standstill. It's a very fluid environment right now. What I want to do is give you guys some oversight on some of the types of questions that have been asked. Mark did a good job of highlighting what that bill may include. I'll let you know some of the stuff that we're hearing from our side, and at this point, what we're able to tell our customers. So number one, once the bill is finalized and signed into law, we'll start reviewing specifics and seek direction from the federal government and from the SBA as to how to disperse proceeds. Because again, we're being told that this will be facilitated through the lending institutions. Again, nothing more to speak to currently, but that's the direction that we've been told. Some questions we've been receiving is, has Wells Fargo received money from the federal government to distribute to small business owners impacted by the coronavirus? The answer to date is no. Wells Fargo hasn't received any funds from federal government at this time. Now, obviously, the bill was just passed. We'll continue to monitor that situation. If you are in contact with your respective bankers, they should be informed as we're informed. Where can small business owners find additional information or resources? So again, there's going to be a lot of information that's being disseminated over the internet about what this bill may or may not include. I would recommend, if you're in a position of desperation and need to get information immediately, best place to start would be the SBA's website. They do have a specific area set up for the COVID. It's disasterloan.sba.gov. That will give you some information, although the last time I checked, which was this morning, the information was somewhat dated. So again, may not be updated for a little bit of time, but it'll at least be a start. They do have an email inbox that you can contact through that website, and they do have also a phone number that can be reached. I will tell you, in speaking with, at this point, it's been hundreds of customers this week. They've been mentioning very long queues. They've been mentioning a lack of a lot of detail. So you're just going to have to be patient. My guess is, obviously, the SBA is going to be very strapped based on their limited resources. Once this is deployed from an institutional standpoint, there will be more individuals ready to help. The problem is, as of this moment, we don't know the specifics surrounding what needs to be collected, how the application process is going to work, and what an application is even going to look like. So again, we know it's a desperate time. Obviously, our goals are to try and assist our customers when possible, and hopefully that's sooner rather than later. If you have existing SBA loans with whether it's Wells Fargo or with another institution that you've made a loan through that pertain to SBA 7A or 504 loans, in speaking to how Wells Fargo is handling these, reach out to your local banker. You can reach out to Holly and get in contact with me as well. We are offering deferment on existing loans that are in our portfolio. There's also rate modification relief options that do exist as well. So if you're in a position where you're trying to see if deferment is something that can be accomplished quickly, there are some provisions that appear to be written into the Act as to how that will be handled by the SBA on a global basis. If it's something you guys want to get in front of and try and take advantage of currently, or because you need that relief, reach out to your local banker at Wells Fargo, and I'm assuming other institutions are in similar situations, and ask to see what deferment options exist. Outside of that, every business has its own unique situation. So I'd say that, when you're speaking with your representative at Wells Fargo or whatever institution you're banking with, talk through your concerns and let them help determine if there's products or solutions available through that financial institution to hopefully meet your needs. It's a very fluid situation. Our hopes are that we have more information sooner rather than later, but really where we sit now in response to the CARES Act is that once SBA does disseminate that information to us, we'll be in a better position to provide more info. That's what I have right now, Holly.
Great. Thank you, Ben. And thanks also for the tips about how to handle existing loans. I think that could be really helpful to many folks. Can you speak just quickly on what is known, if much, not much, about the forgivability of these loans to basically turn them into grants? And what do we know about that, either in terms of criteria that might be used, or at least the intent of those provisions that might suggest future criteria?
I'm going to have to respectfully just let you know we're still waiting for some further dialogues. I don't want to provide misinformation to give anyone the wrong concept of what's happening.
So that's still an area of much uncertainty, it sounds like.
Yes, that's correct.
All right. Fair enough, as unfortunate that is. So Great. Well, thank you for that. And I want to thank folks that have sent in some questions. As with our first one, I've been trying to keep us to just over an hour. If you have other questions or feedback on this call, please contact me as we shape future calls and maybe someday meetings. We want to make sure that we're tailoring it to the information and the issues that you are facing. I want to remind you of the resource page that we've put together at the EDC website, which is edc.org/coronavirus. We have the replay from our first call that happened last week. We have our replay of the economic update that our economist did on Wednesday, as well as we've been taking all of these orders and things that are coming through and trying to put as direct a link to either source documents or the actual application that one of your employees might need to link to apply for unemployment or other types of relief, really trying to put as much of that on the ground linkages on that page. So please use that as your reference. At that point, in order to be respectful of everyone's time, I think I will sign off there. I want to thank everybody for participating. Please do keep sending in your questions. Reach out to me. I can put you in touch with any of the experts that we've spoken with here or elsewhere in the community. Please be healthy, be safe, and we'll be talking soon. So thank you very much, everybody, for participating, and thank you again to our speakers today.
Thank you, Bud.
Thank you.
Thank you.
Thank you, Holly.